Hello, everyone. Today we are starting a discussion in terms of how psycho-oncology, especially the field of oncology, has created a such kind of awareness in terms of reaching out to people, especially cancer patients and their uh, families. TalktoAngel, an online mental health counseling platform, has been instrumental in delivering online mental health counseling to people globally and across India, creating awareness towards mental health and well-being. Today, on the occasion of World Cancer Day, we take this initiative towards spreading awareness and understanding the mental health concerns faced by cancer patients and their families. Today, we have our esteemed speaker, Dr. Harpreet Singh. He is a radiation oncologist and a serial consultant and head of department of radiation oncology at Mohan Dai Oswal Hospital, Ludhiana, and a DNB teacher with more than 34 years of experience in medical field. Sir, as we are discussing about the World Cancer Day today, there are many challenges that a cancer patient face when it comes to their physical illnesses, their mental concerns, and there is always associated some kind of emotional turmoil that the patient go through and their families. Would you like to provide some insight into how the patient, when he hears or she hears about the mental health problems, especially related to cancer? How do you deal with these kind of issues?
Generally, what we see in cancer patients, it's basically after when we give a diagnosis of cancer, they mostly go into four phases of you can say psychological changes. First is denial. They don't accept that I have got cancer. So it
Okay,
takes some time. We give them different reports. Though they need to be convinced. Once they are convinced, then there is an anger. Why me? Why am I getting this cancer? Once we even go through that, then the fourth stage is going to be uh, acceptance. After a bit of you can say psychological upheaval, then they accept. So once they accept that, then comes the fear. That how will I cope with the disease, the treatment, the after effects? So then they we need to counsel them repeatedly about the treatments, the problems that they're likely to face, how to overcome them, what are the different methods of treatment that we can offer them, which is the best. So all these are told to the patient. Once the patient and the family accepts that yes, we have a problem and we have to overcome that.
okay. So, as this is a terminal illness or some sort of illnesses or serious illnesses, which the patient feels a lot of emotions, where he's, as you said, he might be questioning himself, why me, at why this at age of this, मेरी ये age भी नहीं है ये सब deal करने की, तो मुझे क्यों? And it comes with lot of self doubt, negative thinking, and lot of इरिटेशन, एंड वो सिर्फ अपने लिए ही नहीं दूसरों के लिए भी होता है, स्पेशली कंसर्न अबाउट द फैमिलीज, देयर लव्ड वंस. सो उसमें ये साइकोलॉजिकल चैलेंजेस को जब देखते हैं एक ओवरऑल पर्सपेक्टिव में, सो इसको डील करने के लिए हाउ डॉक्टर्स एंड प्रोफेशनल कैन प्रोवाइड सर्टेन काइंड ऑफ रिसोर्सेज सो दैट एक कंफर्टेबल स्पेस प्रोवाइड कर दिया है कि हाँ ठीक है आपको this has been the diagnosis. How in this way how doctors and the psychologists could help in these ways?
What we have a clinical psychologist in our hospital. So
Okay.
generally, if the patients they have a family member or somebody who has undergone this treatment and this disease and has recovered, so they are a bit more positive about it, and
Yes.
they might not require that much of psychological counseling. But patients who have been the first case in the family or
Mm-hmm.
not have been or the family has not been through this problem, so in those
Mm-hmm.
we have a psychological counseling for those patients. Even
Okay.
the American Society of Clinical Oncology mandates that all the patients who have been diagnosed with cancer should undergo
Mm-hmm.
psychological counseling. Not only the patient, the family should
Mm-hmm.
undergo. Because the problem is going to become that patient is going to get treatment. Some will have more side effects, some will have less side effects. So the family also suffers seeing their loved one having a problem or having some complications. And not all patients will survive. Like you mentioned, it's a terminal illness. I would not like to say that it is a terminal illness. Now we have a cure rate of around 60% patients in cancer. Like out of 100 patients, we'll be curing 60%. I'll not call it a fatal disease or a 100% fatality. ऐसे नहीं है. So we have a ray of hope, yeah. But it is a the path is a bit turbulent. It has problems, it has complications. Some people might not feel anything. They just go through it just like a routine thing. But in general, because of the fear and the other things associated with cancer, the families and the person suffering, the patient, they have I'll say, you can say, if I have cancer, I'll be more concerned about how will I cope with my daily routine, how will my family cope without it, what will be the financial implications. Then my children, how will they be able to go to school? Will I be able to afford the fees? Will I be able to afford my with one person not working? Will it be affordable for the family to continue with the way of life that we have? These are the certain issues and challenges that come to the patient's mind when they are diagnosed with cancer.
Absolutely. एंड आई थिंक उसमें थोड़े से हेल्पलेसनेस, होपलेसनेस, कभी कभी एक्सेसिव वरी आ जाती है, कहीं कहीं केसेस में सुसाइड आइडिएशन भी आ सकते हैं, बिकॉज क्योंकि शायद माइट भी पहले कुछ साइकोलॉजिकल चैलेंजेस रहे हों. सो इन योर प्रोफेशनल एक्सपीरियंस, अगर एक कोई कैंसर पेशेंट है और उसको एक काउंसलिंग मिल रही है विद द ट्रीटमेंट प्रोसेस, और एक पेशेंट है जिसको नहीं मिल रही है, हाउ डज दिस difference goes on in terms of providing the quality of the treatment that we look for?
The advantage of counseling is that the patient is made aware of his or her problems and how to cope with it. So a patient who undergone a psychological counseling, they are more likely to complete their treatment as per the recommendation than the patients who have not been counseled. So that is the biggest problem for us. If as an oncologist, if I am not sure my patient will be completing the treatment, so the advantage of taking a half treatment or a quarter treatment is not there. Either you take in cancer, it is either you take a full treatment or you don't take a treatment. So half treatment is equivalent to no treatment. So you spend your money, you spend your time, and then you don't get the benefit. So what we do is we generally in the patients who are more worried, we generally do a repeated counseling. Once counseling is preferably given to all patients. But if the patient is more worried or there are more issues, sometimes patient develop complications. So all these they require reinforcement. So not only for the initial counseling, but also through the treatment and also after the treatment. So counseling is needed. So if once that is provided, the patient is more cooperative with us and takes the treatment better, and also the side effects better. When once they know, yes, I'm going to have this side effect, and this is the way how to go about it, so they accept it better. And again, as I mentioned, it is mandatory as per the not mandatory. It is as per the guidelines. It is recommended that all patients should undergo psychological counseling, and it should not be undermined. Currently in India, these facilities may not be available in all the centers, but yes, like 10 years ago or 5 years ago, it was not available. But nowadays, psychologists and counselors are there in I think practically every hospital that we see.
Right. Okay. Sir, जैसे अभी we have talked about the cancer patients, how oncologist and the mental health counselor do support cancer patient through counseling. जब हम बात करते हैं about the families, they have also been burdened about lot of psychological issues. For example, husband को हो गया या father को हो गया या mother को हो गया, and there is lot of distress which we commonly see in hospitals. it's some kind of emotional turmoil
Mhm.
they go through each and every day. उसके साथ साथ फाइनेंशियल implication. So उनके लिए कितनी important है काउंसलिंग, और उसमें डॉक्टर्स कैसे हेल्प कर सकते हैं, क्योंकि हम अधिकतर हाँ ठीक हो जाएगा, बट दे अंडरस्टैंड दैट दिस इज व्हाट आई एम फेसिंग थ्रू. सो व्हाट काइंड ऑफ हेल्प कुड बी प्रोवाइडेड टू द फैमिलीज?
The problem is that the patients are, every city in India doesn't have a cancer center. So there will be
Okay.
some travel issues. Again, like I mentioned, that patient will see their loved one suffering. That is an issue. Children are the worst sufferers because their needs are the last to be taken into account. In some
Mhm,
cases, I'll not say in every
mhm,
cases.
mhm,
The daily routine of that person, if he or she is an earning member, again it causes a lot of stress. Secondly,
mhm,
there can be some there will be some help from our side. We can give them counseling and all those things that are needed to support them. But
mhm.
the society and the family also needs some support from outside, from the relatives,
Right,
from the office where the person is working.
right.
All those, if they combine to help, I think that will be a much better scenario where the patient is taken care of in the hospital by us and the
Mhm,
psychologist, and at home and other whatever place where they are staying by
mhm.
the other, let's say the community and their place of work. So
Okay, okay.
even to an extent, even the government can help in those patients. Like in Punjab, we have
Mhm.
a facility called a CM scheme, that is the Chief Minister's Cancer Scheme, Health Scheme.
Okay,
They give around one and a
okay.
half lakhs of help
Mhm,
to all patients diagnosed with cancer. So there
mhm,
are
mhm,
certain, like even every state has a little bit of something like that for cancer patients.
mhm.
So
Okay,
which is
okay.
again a big help. There are
Mhm.
certain red tapeism is there, but generally not much in cancer patients.
Okay, okay, okay. So as we are celebrating this World Cancer Day, and WHO has defined something from 2022 to 2024 with the theme of close the gap. So close the gap, what we can understand is the जो cancer patient हैं, they get proper diagnosis, they get proper treatment. But when we talk about the holistic support and for the cancer patient and their families, how professional leaders can provide certain kind of help, certain resources. As you talked about, few of the states have been providing a lot of resources. So, what is your idea in terms of addressing the holistic and close the gap between the cancer diagnosis and providing the support to cancer patients and the families?
So the first thing is that we should do an early intervention.
Okay.
Like in the we should the psychological or the psychosocial support should be intervention that should be early. It should not be late.
Okay.
And secondly, the each and every family has a different sort of a scenario. Like
Mhm,
one family may have some different problem which is on their mind. The second family
mhm,
may have a different question which is on their mind. So a personalized psychological counseling is absolutely necessary. And like I mentioned, that engagement of the community, like the certain other patients who have had gone through the same thing, if they are interacting with this current patient, so that again gives some psychological support to the patient. Like we are doing
mhm,
it in our hospital, we are doing about 2 to 3 meetings a year for the patients who are undergoing cancer and the patients who have already gone through it. So
mhm,
they meet together, and then they would discuss their problems and the
mhm.
solutions that the other person did that.
Okay.
Actually, we can also incorporate like the technological advances, certain like telemedicine can
Mhm,
have virtual support groups. They
mhm.
come up,
Okay.
like we have a stoma laryngeal larynx. Correct? There is a group called
I
which
get it.
uses
Right,
stoma.
right.
Then we have
Yeah.
people who are having a colostomy done. They have a stoma. So there are certain groups
Mhm.
formed which are present all over the world. So
Okay.
and they have individual countrywide
Mhm,
existence. So anybody,
mhm,
any person who is suffering from that or who has a problem with that, they can take their support.
mhm,
Secondly, their patients will have a locational issues, like patient is coming from, let's say, from in Punjab,
mhm,
from
mhm.
a remote area like Mansa, which doesn't have a cancer center to maybe Ludhiana, where I'm based, so which is about
Right.
more than 100 kilometers away.
Mhm.
So we can't do a
Mhm.
daily up and down for treatment.
Right.
So they need some local support also if it is possible. Again, like in
Mhm.
our hospital, we have a sort of a sarai which is decent, and
Mhm.
patients can stay there. But it's not present in all the hospitals. But even then, we can make some arrangements for patients stay around or in or around the hospital at a
Mhm.
rates which are reasonable to the pocket. So
Okay.
all
Okay.
those things which will help. And but I think the combining the early intervention, the personalized care to all the family, from the
Mhm.
help from the community, and also
Mhm.
incorporating the technology, all those things will provide a holistic care to all the cancer patients and their
Mhm.
families throughout their
Mhm.
journey.
Okay. Okay. As you talked about, there is a distance between, like you mentioned, there would be a rural areas and there would be a certain center which is located in city. And जो उनको care चाहिए, especially psychological care in terms of addressing it. तो in terms of mental health counseling, yeah, psychological counseling, how does these platform just like talk talk to angel could help in terms of addressing to those people who are located in remote areas?
Like I think telemedicine is coming up in a big way. Like we saw it, especially in
Mhm.
the COVID times, where
Mhm.
to do it. And I think Supreme Court has given some guidelines for undergoing that telemedicine. So if the in a
Mhm.
good setups even villages have some hospitals, so those
Mhm.
hospitals can tie up with their bigger centers and have a telemedicine setup, so that
Mhm.
the patients can go nearby, consult their doctor online, and it should be equivalent. If the doctor feels yes, there is a need for something to be done which
Mhm.
cannot be done
Mhm.
locally, so then they can come. But otherwise, most of the things like
Mhm.
ultrasound, X-rays, and blood tests, they can be done generally in
Right,
uh,
right,
in remote areas also.
right,
So
right, right.
I think this will help a big way, especially the patient that doesn't have to commute every month or every
Yeah.
2 months. So it will help
Mhm.
us. It will give a psychological support to the patient that yes, I am not that serious that I need to come to the hospital frequently.
Right, right, right.
But psychological benefit is also going to be there.
Absolutely, absolutely. So, as we can understand the importance of providing the proper diagnosis, proper treatment with association with mental health counseling, whether it's online, offline, whatever way, addressing to this mental health aspect of cancer diagnosis and treatment becomes very important. As
Yes.
we are celebrating this World Cancer Day, would you like to give some insight in terms of to the patients out there, to the families out there. Just few lines so that we can conclude this discussion.
My thing would be that डर के आगे जीत है. So
Okay.
उससे डर से निकलना पड़ेगा. Cancer definitely it is a fearsome thing, but हिम्मत तो रखनी पड़ेगी. You have to have some you can say the
Correct.
inner strength to deal with that. So
Okay.
घबराना नहीं है. There is hope. There is scope. So
Mhm.
don't worry. So if
Okay.
you for the people who are not suffering from cancer, get your health checkups done every year, so that if there is any small thing we can detect early, so we can give you a 90% plus cure rate. uh,
Mhm.
Second thing is that most of the 99.9% tests will be okay in
Mhm.
99.9% of the patients of the not I'll not
Mhm.
call them patients, or of the persons, the
Mhm.
report will be okay, because the incidence of
Mhm.
cancer is around 150 per lakh, so which is
Right.
about 1.01% So it's not
Right. Right.
frightening, but uh, delaying a thing just because it might be cancer, and then getting it in a third or a fourth stage is doesn't
Mhm.
make any sense. So don't be
Absolutely.
afraid. Get your tests done frequently. Avoid tobacco. Tobacco is
Mhm.
a killer. It not only causes cancer, it causes multiple other diseases, right from heart pain to brain to strokes to multiple other problems. COPDs, like lungs can get affected. So
Mhm.
it causes a lot of problems. So avoid tobacco in any form.
Okay.
Alcohol, again, I'll say take it in moderation or avoid it as far as possible, because that is
Okay.
also not like tobacco, but Number two is alcohol. So
Okay.
it should be avoided as far as possible. Take your vaccines.
Mhm,
The hepatitis B vaccine for the ladies, for the cancer cervix, cervix
mhm.
vaccine, so that you don't develop cancer. So one of
Yeah,
there are
right, right.
whatever preventive ways we have. Increase
Mhm,
vegetables in your diet, especially the
mhm.
colored ones. Avoid
Right, right.
food, red meat, all those things that जो हमें पता है. Do exercise.
Mhm.
ठीक है ना?
Yeah,
This will prevent cancer. And all those
yeah.
who have had cancer, it will prevent a recurrence. They will not have a cancer again. So
Mhm,
all these
mhm,
things help. So my take is don't be afraid. Take it headlong. There is a lot of
mhm,
scope and a lot of research is going on. I think we will be in another few years. Things will be much different than they were, let's say 5-10 years back. So
okay.
now we are like in radiation, we used to have around 40 or 35 or 30 fittings. So now we are slowly
Mhm,
coming back to reducing the number, increasing the dose. So
mhm,
the patient doesn't have to spend time away from their families. So all those
mhm,
things are being taken care of.
mhm,
I think the scenario is not that bleak. It is
mhm.
there is hope. The sun is rising. Don't worry.
Yeah, yeah. And we have our mental health professionals to support the cancer patients and the families all their through their life. Thank you so much, sir, for your time, giving us this important perspective about how cancer diagnosis, treatment, as well as the counseling could help them the recovery. And as you said, ki himmat rakho. There
Yes.
is always a light of hope.
Yeah.
Thank you so much, sir, for being there.
Thank you.
Thank you so much. Okay, thank you, sir.
Thank you.